Hello and welcome to WilmingtonBiz Talk, presented by the Greater Wilmington Business Journal. Today we are talking with David Howard, New Hanover County Health Director, about the Omicron variant of COVID-19 and the county's new pandemic operations team. But first, we will hear a message from our sponsor.
Hello, I'm Ann Gardner, CEO of Cape Fear Realtors. Realtors support this program's efforts to connect our community in meaningful dialogue with actionable insights. Realtors are dedicated professionals who build strong, resilient communities and businesses. Work with someone you can trust. Work with a realtor. Learn more at capefear.realtor.
Hello, today on Wilmington Biz Talk, we are discussing COVID-19 and the latest variant that folks are worried about, and also some of the initiatives that the New Hanover County is taking to address this pandemic and possibly future ones. So with us today is David Howard, a New Hanover County Public Health Director. Thank you for being with us today, David.
Yeah, you're welcome. Thank you for having me.
First, I want to talk about the Omicron variant, and there's been a lot of news stories every day about it, and it's a little bit confusing. And on top of that, people are, battling COVID fatigue even while they're still trying to be careful. So, what do you think are some of the most important facts people should know about the Omicron variant?
Well, Cece, you summed it up pretty well. I think we're all having some level of fatigue around feeling the logical need to continue some mitigation and preventive measures to control the rate of spread of whether it's Delta or Omicron or any variant that we have spreading right now. We're still predominantly, we still have the Delta variant spreading in the U.S. We have picked up in about 20 states at least a couple of cases that have been diagnosed and identified as Omicron. I think what we're seeing in the news is often good snippets of information. So we've seen Dr. Fauci, Dr. Walensky, and many others say, well, we have some early indications that perhaps the Omicron variant does not cause as severe an illness.
Right.
But you haven't seen CDC officially come out and say that because they're waiting for a more comprehensive group of information from both laboratory study, where scientists are looking at the very specific modifications that have occurred with this variant in the spike proteins, for instance. They know some of those from previous variants. Some of them are new. So they're sort of postulating and predicting what might that mean for certainly illness, but also transmissibility. And those are to be determined for sure. And then the epidemiological data from what happens in the population is the other set of data that we need from large populations. We also need to know how it affects people who have been vaccinated and what their status is and their health status versus people who are unvaccinated. Now in the US, the numbers I've seen, the cases, the handful of cases we know about are in both vaccinated and unvaccinated, but about 75% of those people were vaccinated who have been diagnosed with the Omicron variant in terms of the virus that they picked up. So
sorry, real quick. So does that mean it's breaking, that Omicron is breaking through?
Sure, and viruses do that. Similar to Delta, and I'm sure to some degree the original virus had some capability to break through. That's never an absolute, that a virus can't break through a vaccine. Similar to what we're always used to in terms of flu vaccine. That has to change every single year because the predominant flu strains change every year as the flu transmits around the globe every year, and mutations in different strains of the flu occur. And so that vaccine is made up of several different strains to try to prevent as much as possible widespread impact from flu each season. And the same thing is happening with the family of viruses that have branched off from the original COVID-19 coronavirus that was novel to the human population. And so it's a family tree now. Omicron's in the news now. Delta was in the news for a good 4 months, right? 4 or 5 months. But there are many, many, many other variants that are much less concerning, much less significant in terms of the mutations that were found in those variants. There are subvariants of the Delta variant. So it's a very large family tree by now. So when the WHO and the CDC designate a variant as a variant of concern, as they've done with Omicron and as they did with Delta, that pops to the top of the pile in terms of newsworthiness, and rightfully so, because the variants they see, such as what we've heard, the mutations in the spike protein, are worthy of some concern because it remains to be seen, but the worry is that they'll have some different impacts, both in terms of illness severity, perhaps transmissibility, and whether or not the vaccines are effective or completely effective, or to what degree they prevent serious illness. So far, what we've seen is in most of the populations where Omicron is spreading relatively broadly, the vaccines are effective. And remember, the main goal of any vaccine is to keep people from getting severely ill. You may still get the virus,
Right.
you may get symptoms, you may not. You may have a 2-day bout with the flu or COVID-19 or what have you, but get better without any serious high level of treatment. And that's really the goal. And that's the goal for the community as well, right? For the hospital system, healthcare system. We want people to, if they're going to catch it, to get through it for the most part on their own with some lower level care.
Do you
Monoclonal antibodies or with other treatments without having to engage the healthcare system.
right. And do you have any idea when and if we might hear about cases here in Hanover County of Omicron? I don't know if there's any in North Carolina.
According as of today, the closest state that they know of Omicron appearing is Georgia, and then in Maryland, Virginia, North Carolina, South Carolina have not confirmed a case yet. Doesn't mean it's not here. It means because that has to be a DNA sequence, and of course we can't sequence every testing sample that comes across from the broad scale testing that happens. So it may well be here, close by or within the state. Certainly, since we have major airports in major cities, and so it may be present. I think the really important part take home there is to, we can assume it's going to be here soon, if not already, and exercise those tried and true precautions that have been working to limit and control the spread, the pace of the transmission of Omicron or Delta or any other variant of the virus, so that we can all continue our activity and not see major impacts.
It seems like we would know fairly quickly whether Omicron is going to be kind of like Delta, which I know is still around and still causing problems. But as far as, it's spreading to a lot of people and breaking through. It seems like we'd know that in the next few weeks, or if Omicron is as bad as feared, or I don't know. I'm not saying it exactly.
So
right.
it'll right, and that's what I mentioned earlier. You have lab tests,
Yeah.
right? You have
Right.
laboratories looking at the virus itself, and based on what they're finding, saying, well, what could happen, given what we're seeing, is it may be have this impact or this impact in terms of transmissibility. This is looking a lot like Delta in this way, but not as much in this way. And then you have the population data, which, unfortunately, to some degree, you have to kind of wait for. It has to be present in a population in a great enough number to see, to garner any information in terms of who it's going to make sick, what effect it has, how many breakthrough cases you have, and most importantly, how many of those breakthrough cases might result in serious illness. And that's partly why the CDC and the FDA moved forward with making the booster shots, booster vaccines available for everyone, 18 and above, so that everyone has the opportunity to give themselves that boost of immunity from the booster leading into the holidays. And if you haven't gotten that yet, even though we're only a couple weeks from Christmas, go ahead and get started with your boosting your protection. And that will go a long way in preventing some transmission. You'll also prevent a lot of serious illness, so that if someone does get it, like I said earlier, it may affect them with a light illness, and they're back to functioning pretty quickly.
Right. And if it is a light illness, you're not going to know what, I mean, you might not test for what variant it is, right? I mean, there's not like widespread variant testing.
Right. So the variant testing and the sequencing, as they call it, is really pretty random. And they want it to be random, but of the broader testing universe, so that they're able to, in a more predictable way, know where it is. So they're not basing that necessarily on characteristics of individual illness within people. So they don't pick and choose based on severity of illness or anything like that. They're randomly selecting samples to choose to sequence to a certain number from certain locations, certain areas, certain regions, in order to identify the variants that are present.
Okay. And then like you were talking about the booster, if you got your booster now, you would still obviously get some protection from that if you're having a family gathering or being out and about because of the holidays. Is that's
the
correct?
booster's been shown to be very effective in boosting, as the name implies, the immunity back up to high levels that you had soon after someone received either the 2 doses of Moderna or Pfizer or the initial dose of Johnson & Johnson several months ago. And of course, the criteria is still 6 months after either Moderna or Pfizer full vaccination, or 2 months after someone's initial Johnson & Johnson dose.
Is there talk now of a fourth shot, or is that more like 6 months from now? If you got your booster, there'll be another booster. Or what's the talk about that?
Most of the discussion, I have not heard any discussion of a fourth shot, second booster, whatever you might call it.
Right.
We're moving into the realm of whether or not this is going to need to be to some degree, some scale of an annual opportunity for people to be vaccinated against this, like I said earlier, this family of viruses.
Right.
Also, Pfizer, Moderna, Johnson & Johnson, all the companies who are engaged in creating vaccinations for these viruses are now studying and prepared to re-engineer their vaccines, right? To remake those subject to and be more specific to more dominant variants. So, for instance, we saw the Delta variant sort of crowd everything else out.
Mm-hmm.
It was highly transmissible, and that's what happens with these. A variant comes along on that family tree and crowds everything else out, and all the other variants in the original virus are all but eliminated because the others are mostly more successful at transmitting. The severity of illness is not really a factor in that. It's just when one variant is much more easily transmitted, it just outpaces all the others. We don't know yet if Omicron's going to do that to Delta as Delta did to the other previous variants from earlier this year and last year.
Okay. And the county lifted its mask mandate. And then this week, the Hanover County schools, the board lifted that mask mandate and made it optional.
Right.
As a health department, do you look at that and sort of prepare for a potential increase in cases with masks, the mask mandate lifted in schools, or how do you predict that kind of thing?
Well, we've seen an increase, which is not a surprise for a couple of reasons. Maybe some people don't feel as obligated to use a face covering in public indoor places since the Health and Human Services Board rule was lifted. I think we also are going to see a bit of a bump because of Thanksgiving. A lot of travel, a lot of people getting together with others, maybe in their extended family, but not in their immediate family household and workplaces. And so that's to be expected. As we saw last holidays, we're in a much better place this year with a lot of vaccinations in place. The hope is that we make the switch to everyone using the guidance as they're prioritize using the guidance of using a face covering in public indoor places, maintaining distance, limiting trips to public places if they can, protecting those around them, family members, workmates who may have higher vulnerability to severe illness and hospitalization from contracting the virus, using good hygiene, both at home and in the workplace, and personal hygiene to limit the transmission of certainly not only COVID viruses, but the flu virus. We've seen some upticks in flu virus in the, I guess, young adult, college age campus population in different places across the country. So that's beginning, right? That season is beginning in earnest now as well, which we didn't see last year. We had so many good controls, mitigations in place last year that in going into the fall last year that we didn't see a lot of flu last year. And so that's good proof that all those measures work. We would encourage people to use those voluntarily so that we are all doing our part to, as I said earlier, control the pace of any transmission that's going to happen, whether that be Omicron or Delta or the flu. The object is to control the pace, avoid any spikes that have very detrimental effects, not only on our healthcare system and the staffing there, but workplaces and other places where we want to keep going as normal as possible.
Okay, well, and tell us about the county's new pandemic operations team. The county's devoting $3.7 million to this team and is in the process of getting the team in place. Is that correct?
Right. So fortunately, the American Rescue Plan funding that has been made available allows us to enact a resolution, sort of a measure to remedy one of the lessons learned in a short-term emergency response, whether that's a communicable disease or a hurricane in our area. A couple of weeks is manageable for our staff, a small company, a large company to work through, right? This is going on 2 years of a response to a emergent situation that has seemed more urgent sometimes and less urgent other times, like over the summer when our cases and positive tests dropped so low. We thought we were in a good place, and then Delta arrives, right? So it spikes back up. So it's been a bit of a roller coaster, quite literally, even if you look at the graphs that we show sometimes. I think the lesson learned was we need capacity to maintain continuity of operations of all the services that Health and Human Services and certainly the entire county provides to the county. We were, doing a lot of shifting around personnel, resources, time, energy from our personnel to cover all the duties we needed to provide for COVID-19 response, in particular the vaccine campaign, beginning right before Christmas last year, all the way through this year. We've been very focused on making available vaccine to anybody who wants to take advantage of that. And that involves a lot of planning, a lot of coordination, a lot of equipment, a lot of personnel time, pulling school nurses and clinic nurses and community health nurses and volunteers and contractors. And so the pandemic operations team is designed to replace that effort, manage. So not only personnel to do the work, but to plan. We're hiring an epidemiologist as well as a manager for the team to coordinate and plan and manage the remaining COVID-19 response. And going forward from that, as well as COVID-19, other communicable disease efforts in the community, other variants that might occur next spring, which could be dangerous as well. Hopefully that doesn't happen, but we need to be in a better position to maintain continuity of operations and respond to the community and provide the community good information, good response, and good availability of service.
So that team will it be responsible for vaccination efforts for COVID-19 once it's in place? It'll be the
right. We'll have nurses on staff on that team, and as well as contact tracers on that team. So there'll be a subset, sort of a complete package, if you will, of a COVID-19 response team to be able to handle most of the responsibilities and activities and services that we're providing around the COVID response.
I heard this morning in the news that 200 million Americans have been vaccinated. It seems like the people who have not been vaccinated at this point are fairly entrenched and do not want to be vaccinated, but do you feel like there's still some value in, publicizing vaccination sites and trying to get people to get that vaccine and their boosters?
I do. We're seeing a relatively steady clip, especially as the vaccines roll out. They're including more and more populations. Relatively recently, we saw the 5 to 11 age group approved for the Pfizer vaccine. We've seen a steady stream of parents and children coming in for that. So it's worthwhile because it still works. It's still an excellent and the gold standard for us in terms of preventive measures against this original virus and all the variants. So as people continue to examine that, we encourage people to do that, continue to examine the evidence, the cost benefit and the value of being vaccinated, the same as any other vaccination against any other virus. It prevents a lot personally, but it also provides a lot of benefit for the community. It provides a lot of benefit for your coworkers. We often don't know the medical histories and circumstances of people around us, people we encounter at the grocery store, people we work with every day at work, and we may be protecting them from something pretty harmful just by getting a vaccine and at least reducing the chance that we might contract the virus and transmit it. As I said, vaccines don't prevent anything 100%. That includes transmission, becoming ill, contracting the virus, but it does reduce the risk considerably. And that's what we're after, reducing the risk across the board using many different mitigation measures.
Okay. And do you have any advice for this holiday season as far as gatherings that are coming up? We're past Thanksgiving, obviously, but with Christmas and everything, New Year's, do you feel like people should wear their masks when they're at parties or dinners, or what do you think?
So first and foremost, try your best to enjoy it safely. If whatever holiday you celebrate, enjoy it to the fullest extent you possibly can, because we all kind of deserve that, right? We've been through a lot, no matter what kind of work you're in or what your situation is. It's been a relatively stressful year, 2 years. But to your point, if you're around others at a work party, a public setting, a restaurant where you're out, consider, first of all, if you're not comfortable using a face covering, consider whether or not you need to be there if your health makes you vulnerable to a serious illness, or if you're unvaccinated and you've made that choice not to be vaccinated. Probably the next best thing you could do is stay away from others as much as possible, just because there might be a risk that you have contracted the virus, don't even know it, and maybe transmit it to someone who transmits it to their grandmother when they go off for Christmas to see them, and it makes them seriously ill. That's the really tough part about this virus. We can't see it, right? We can't see it coming. We don't always know when we have it. We don't know when we're transmitting it to someone, and 2 or 3 people down the line, it might put somebody in the hospital in serious illness situation. And so it would be easier if we could see it and we would know, right? When we have it reliably and when we might be transmitting it. But sometimes it's hard to say for sure. So certainly if anyone has any kind of symptoms of any kind, please stay home from work, stay home from school, etc. That cuts back on transmission leading into the holidays. If we do have some flu going around, we have some common colds going around, and all of that helps to create an environment where everyone's staying as healthy as possible. And if you've been exposed to someone who's tested positive, please follow that quarantine guidance. Follow that guidance, use a face covering, especially then, to reduce the risk, again, of transmitting the virus. Get tested yourself to assure that you're not carrying the virus and transmitting it unknowingly. And of course, as we know, it is possible to contract the virus if you've been vaccinated. There are breakthrough cases, but oftentimes people don't have symptoms or they might have very mild symptoms and they just keep, working through that. But they may be transmitting the virus to others. So it's just a smart practice, both for others and yourself, to use face coverings, avoid large crowds, especially if you're not vaccinated. If you are going to visit family, take precautions. Doesn't have to be a big holiday discussion or a debate about masking or vaccines. just take logical precautions, be outside if you can, if the weather's nice. All those basic measures can help limit the transmission.
Okay. Well, thank you very much, David. I appreciate it. And we'll probably have you on again. Well, hopefully not. Maybe
Well,
we
maybe
will.
not, hopefully.
Yeah, maybe we won't need to have you on again. But we do appreciate you coming on and sharing that information with us. Thank you so much. And
Absolutely. Thank you.
everybody has a great day and great holidays. Thank you.